2-minute anesthesia arterial tourniquet. Please like, subscribe and comment. Arterial tourniquets control blood flow to and from the limb. They're used in the operating room to create a bloodless surgical field, and they're based on 5 components. An inflatable cuff, which is usually inflated to 100 mm of mercury above the systolic pressure for less than 2 hours. Tubing, a pressure regulator, compressed gas source and a display. Most literature states there's no absolute contraindication to arterial tourniquets. However, there's groups of patients who are high risk of complication. These include those with Raynaud's disease, sickle cell, fistula, and patients with a background of severe peripheral vascular disease, VTE, localized skin infections and skin grafts over the area of application. Systemic effects are usually related to the inflation, i.e. movement of blood into the systemic circulation, and deflation, i.e. movement of blood back into the limb and redistribution of waste products, whilst ongoing limb compression can result in compression of local structures and limb ischemia, resulting in complications. Inflation of the arterial tourniquet is preceded by compressive exsanguination of the limb. This results in an increase in circulating volume and thus increase in systolic blood pressure and CVP. Patients with extremely poor cardiac function are at risk of acute heart failure. Hematological complications of inflation lead to increase in platelet aggregation due to the stress response, but there's no overall incidence in VTE. Deflation of the arterial tourniquet results in the redistribution of blood back into the limb from the central circulation and release of waste products from anaerobic metabolism and also cell injury. This results in a range of systemic effects, including reduction in mean arterial pressure, CVP, and risk of arrhythmias. Increase in CO2 leads to an increase in minute ventilation, increase in cerebral blood flow, increase in ICP. Hematological, there's also a risk of increased fibrinolytic activity and thus bleeding due to the release of tissue plasminogen activator. And finally, general issues include reduction in temperature. Arterial tourniquet complications due to ongoing compression of local structures. These can be split up into systemic and local effects. Systemic, pain via unmaniated C-fiber activation leading to the activation of the sympathetic nervous system causing tachycardia, hypertension. Local effects due to local structure compression. Muscles. This can cause localized muscular ischemia leading to local fiber necrosis. Nerve injury. Predominantly larger nerves and mainly loss of motor function. In the upper limb, radial nerve, lower limb, peroneal. Skin injuries are uncommon, but excessive tourniquet time or poorly placed tourniquets may result in abrasions, blisters, necrosis. Vascular. Increased risk of vascular permeability leading to limb edema and acute vascular insufficiency from plaque rupture. Key points for tourniquet safety include avoid aggressive limb exsanguination, use a tourniquet for the shortest duration of time, and avoid overpressurization.